So that should,
This is the touch screen?
yeah, that's the touch screen. going to start in about 60 seconds. Everybody start, get a drink, get a beverage, get something to eat. We'll start in about 60 seconds. All right, good evening. Well, it's my pleasure to welcome everyone to the graduation ceremony of the Cahaba UAB Family Medicine Residency Class of 2025. So, my name is John Waits. I have the pleasure of co-founding and directing the Family Medicine Residency with Dr. Lacey Smith, along with our wonderful track directors and faculty at each of our 4 campuses. Rural in Centerville in Bibb County, urban in West End, the west side of Birmingham, Highlands on the UAB campus, and Frontier in rural Perry and Wilcox County. It's one accredited program with 4 distinct campuses. And this is Cahaba's largest graduating class yet, and the largest graduating class of family medicine residents in the state. We have a wonderful staff, without whom none of this would be possible tonight. Please give them a round of applause for all they do each year, especially every June, including this event. Cahaba Medical Care is a 501c3 nonprofit community health center and is the sponsoring and funding institution for the Cahaba UAB Family Medicine Residency Program. We have 27 locations across 7 counties in central Alabama. We're one of about 70 residency training programs called teaching health centers. We at Cahaba and teaching health centers as a whole have had an almost decades-long journey of training, recruitment, and retention to underserved areas. We have 20 of our alumni from our rural programs working in rural areas across the country, many of them in Alabama. That's 43% of our rural graduates working in rural areas compared to a national average of 5%. And across our 91 at 5 p.m. on June 30th, we'll have 91 graduates. 65 of them will be working in underserved areas. That's 71% of our graduates compared to about 25% nationally. This has also been a decades-long journey, about a decade and a half, for the teaching health centers around the country. Our funding comes from the Department of Health and Human Services. If you pay attention to the news, you know that we are on a journey towards showing that we are efficient with our federal dollars. I just showed you those pie charts to show the efficiency of your federal tax dollars with this training that's happening tonight. I haven't asked of you parents, friends, family, and all of you graduates, everyone. So this QR code here will take you to a place where you can type in your zip code and find your elected representative. Just tell your story about your graduate. Tell them what teaching health centers have meant to you, and especially find your senator. This is the QR code to your Senate office. That is their health committee is where our funding will be up for debate over the next few months in this fall. So I'd appreciate your time and attention to that. So I want to welcome a few groups of people here. So I want to, this has been speaking of a decade-long joint venture with the UAB Heersink School of Medicine. It has been a fantastic academic partner to this academic/community joint venture. Since the second year of our rural track back in 2014, and then scaling that relationship in 2018, as well as dreaming up all the different things that we've done with UAB. They provide not only a fantastic tertiary care rotations to our residents, but also family medicine collaborations, research, graduate medical education mentorship, and of course our Highlands track. This has been a great partnership for these many years. So I want to thank the UAB colleagues, faculty members, administrators who are here tonight in support of these graduates. If y'all would give our UAB partners a round of applause. As fantastic as the Cahaba Medical Care and UAB faculty are, we could not pull this off without our community medical preceptors, as well as many other stakeholders who might be here. Our hospital partners, there's at least 9 different hospitals our residents rotate at. Cahaba's Board of Directors, Viv Medical Center, UAB Medical West, J. Paul Jones, Baptist Princeton, St. Vincent's, just to name a few. If any of our community stakeholders are here, we would love you to stand up and let us recognize you for supporting this program for a decade. Thank you for being here. I'd like to also not forget the nurses, advanced practice providers, medical assistants, receptionists, any other administrative staff from Cahaba or UAB that's come out tonight. Y'all have truly helped train these professionals in utterly essential ways that the faculty couldn't do alone, and especially the graduates. Would y'all give your MAs and receptionists and team a round of applause? Certainly not at the last of the list. None of these graduates would be here without the love and immense support of parents, families, spouses, significant others, and not a small number of friends. If you're in this category supporting a graduate tonight, would you stand up, please? And let's take a moment to honor your contribution to the decade-long training. Well, graduates, the moment has arrived. You are at graduation. And remember, we're collecting these diplomas till 5 p.m. on June 30th. You've got a bunch of charts to sign. But anyway, that's not the purpose of tonight. Graduation from a family medicine residency is a culmination of over a decade of training. In almost every case, it is substantial delayed gratification. There are very few other jobs, careers, even professions that take someone at the pinnacle of their academic career, getting a doctorate from a university, medical school, graduation from a doctoral program, and submit them to something as thankless as an internship in a family medicine residency program. Meanwhile, all the other classmates from high school are climbing corporate ladders, growing families, and most of all, financial security. But today has arrived, the final chapter, and these physicians deserve our honor and congratulations as they embark finally on the next chapter of their profession. Would you give them a round of applause? So, tonight represents another milestone. Our Highlands track on the UAB campus and our Frontier track in Perry and Wilcox County. We started these two tracks, our second urban track and our second rural track, at the same time. And tonight represents the first class of graduates from these 3-year programs. And so I thought it'd be great to ask Dr. Irfan Asif and Dr. Sumter Blackman to kind of commemorate these graduates with a bit of an urban and a rural flavor. I've limited them to about 2 hours each, so we'll get out of here in plenty of time. They'll go one after the other. It's my great pleasure to introduce my friend and colleague, Dr. Irfan Asif, one of today's commencement speakers. Dr. Asif is a nationally recognized leader in family medicine, sports medicine, and medical education. He serves as the Heersink Endowed Professor of Sports and Exercise Medicine, Associate Dean for Primary Care and Rural Health, and Chair of the Department of Family and Community Medicine at UAB. He also directs UAB's primary care service line. He is a passionate advocate for health equity and education. Dr. Asif has championed innovative training programs for underrepresented students in medicine and has led groundbreaking research in many areas of sports medicine. He currently chairs major national committees in sports medicine and family medicine and is the team physician for UAB Athletics, the Birmingham Legion, and USA Wheelchair Rugby. His work has received over $60 million in research funding, and his expertise is recognized globally. As recently as a few months ago, he was the opening keynote speaker at the 7th International Olympic Committee World Conference. So with this deep commitment to community care and love for family, sports, medicine, please join me in welcoming Dr. Irfan Asif.
Well, I appreciate everyone being here. It's always hard to follow John Waits, especially when my talk is about leadership, because I think he is probably one of the quintessential leaders. And when you think about vision, I don't think you can get more vision than someone like John Waits, as you can see here. So appreciate the opportunity to come and speak with you today. My goal is to talk about leadership and to help you understand that as part of graduation, you are a leader, and now you are asked to shape the future of family medicine. I remember being in your shoes like it was yesterday. I remember my first patient in clinic, Gloria Davis, who came to me. She had end-stage renal disease, was in dialysis, came to me once a month for 3 years, and unfortunately passed away at the end of my residency. But I'll never forget her, I'll never forget my first delivery. I'll never forget some of my patients with mental health issues. So Mr. Marsh, who wanted opioids for an earache, and I didn't give it to him, unfortunately. He then came to me the next visit, said he was really upset that I didn't give the pain medication to him, and he named a cup Dr. Asif and threw it against a wall until it broke. So, again, stories I'll never forget. I remember trauma in the ICU and in the emergency room. I remember my first patient who had a cardiac arrest when I was covering a marathon, and that is part of the reason why I do both family and sports medicine. And as I speak to you today, again, about leadership, really what I want to talk to you about is the ability to have, as we talked about with someone like John Waits, strategic vision and thinking, the ability to collaborate with others, and then also the ability to seek feedback so that you can always improve. That's what I want to make sure that you take away. I think you've already learned those things, but it's important to really think about how you can use those moving forward. To understand my journey and the leadership that I try to follow, I think you have to take a step back and understand where I came from. So I actually grew up in a household with a Muslim family. My parents are from India, near Bangalore, and they came to the United States in the 70s. So that was a big part of my upbringing. I remember going to soup kitchens and doing a lot of volunteer work, and just like many of you, faith was a big part of my childhood. In 1995, I think many of you may or may not remember the Oklahoma City bombing. Actually, a lot of people at that time thought the Muslims were the ones that caused the Oklahoma City bombing, and that was what people first thought. And so I was actually getting off a bus around that time, and some people jumped me and said, "You're the reason that this happened." And it's one of those memories to think about. It's sort of the things that happen to you, and it's the way that you react that really shape who you are. And back in 2000, around 9/11, another incident again happened with the bombing, the terrorist attacks in New York. And so at that time, I also had people who came up to me and said, "You are the reason that this happened. Go back where you came from." And I said, "Well, I'm from Cincinnati, Ohio, so I can go back there, you know." But again, I think I'd grown up, and so instead of getting into fights, it was trying to have a conversation with people to think about how we can change the world. And again, I think that you have been called not only to this program, but also to change the world. It was these roots of mine, again, thinking about the underserved, that have shaped who I am. And so even though I was very interested in sports medicine, played soccer, and was really committed to going into sports medicine, I thought orthopedic surgery was the only way to do that. But I found out that primary care and sports medicine, you can actually find ways to mix the two together. So I went to University of Washington, and then after I graduated, went to the University of Tennessee, and I've been working on trying to prevent heart problems in athletes since I told you that first story where I saw someone collapse, and I was the first responder for a cardiac arrest at a marathon. So went to University of Tennessee, worked there for a bit. My wife is an animal eye doctor, and her stories beat mine any day. She sees giraffes and bald eagles and horses. I mean, again, if you want to have a good time, I would go talk to her instead of listening to me. But we were at the University of Tennessee, and then I was at the University of South Carolina, where I was the vice chair of academics and research, and I started to think about, well, instead of just preventing heart problems in athletes, can I think about how we prevent heart problems in everyone? So we started to think about how we might do exercise as medicine programs, which again, if you think about exercise and nutrition, it's at the base of every algorithm that you have and trying to prevent lots of chronic disease. So we've been trying to grow programs like that since then. At the University of South Carolina, I had an opportunity to build, just like we're seeing here with the different tracks that we have, Highlands and also the Frontier. I built 2 residency programs there, and it was actually the opportunity to come and do something similar here that brought me to Alabama. So as we think about Alabama, this is a state that has a significant primary care shortage. And when you don't have people who are there trying to prevent disease, you end up with a lot of disease. It's not that hard. So if we are in the bottom 5 for people who are trying to prevent disease, we then end up in the bottom 5 for every chronic disease that you can see here. So whether it's obesity, high blood pressure, diabetes, mental health, all the things that you've seen in your training, Alabama is a perfect place to try to think about how we can prevent those things. And again, this is a place with a lot of health inequity in addition to the primary care shortage that we see. As John talked about, 7 years ago, I came here and had an opportunity to work with him to think about how we might expand the residency program. And it was a conversation that I had with him even prior to coming here, thinking about how we might grow something like this. And it's really been an honor to think about how you can grow a program, mix with the Resurrection program here, mix with the UAB, and come up with something so wonderful as you see today. Graduating 20 residents, 60 residents in total, and continuing to grow, including a new program that will be focused on psychiatry. Again, it's a huge honor to think about, and I think all of you should be really proud of the work that you're doing. As John mentioned, the collaboration that we've had with UAB and Cahaba Medical Care and everyone else in the state has really led to trying to address that vision that we talked about, that shortage of primary care. We are starting to make a difference. You can see here, as John said, 71% of the graduates are practicing in underserved areas. Over 50% are practicing in Alabama. So again, we are leaders, and you are going to be the ones addressing some of those significant challenges. I think it's important to remember, though, that you don't just treat a disease. You treat patients, and at the heart of what you do, you build trusting relationships with those patients. Nowhere else in the world will someone come and talk to you about the things that bother them the most, their marriage, their kids, their parents, their stressors. But when you put on that white coat, it gives people the green light to be able to talk to you about those things, and that's important. Again, people are the things that make you in family medicine different than any other specialty. And the ability to work with people is the reason why you are also leaders, probably better leaders than any other specialty in medicine. The last point that I wanted to talk to you about, we talked about having a strategic vision, the ability to collaborate again with great partners like Cahaba Medical Care, the ability to seek feedback and to have humility to ask how you might be able to do things better is something that I personally think about and value as a leader, and I ask you to think about the same. The ability to always make things better is one of the reasons why we've been able to think, well, I think about you as all being scientists. So science is asking how we might be able to ask a question and then how to address that question. And so one of the unique things that we've been able to do in this partnership is to think about how science might mix with the educational space. And you've seen that with Cahaba and UAB coming together, you have a program with 60 residents, so we are killing it on the education side. And so now we're thinking about how we might do the exact same thing on the research end. So John talked about advocacy, and through various advocacy efforts, we actually were able to work with the NIH over the past several years to create the first primary care entity within the NIH called Care for Health. And they have been focused on health equity. And you can see that the collaboration with different groups, if we all work together with our different preceptors, with our partners in academic institutions, our FQHCs, we actually can have a large swath of the state where we start to make an impact. And now you think about how you might be able to make an impact in science. And so we were one of the first hubs to actually receive one of that new grant that came out of the NIH. We actually received one of the first awards, and it's really because of the work that we do with Cahaba Medical Care that we've been able to receive that award. So I'm excited to continue that collaboration in a new space. And the two studies that we were matched with was actually one focused on hearing loss in the Black Belt, and another focused on obesity treatment in rural populations. So this idea of asking questions, how we might be able to do things better, mixes in with research, and that's something that I hope you all might think about in your future practices. Leadership is really important, and the idea of thinking about treating patients, communities, people across the globe, it's probably no better time to be able to think about something like that than now. We have a lot of conflict in the world around us, and it's upon all of us to think about how we can approach that conflict and try to bring people together. My ask of you is to think about how you might use your leadership skills, your strategic thinking, instead of just reacting in front of you. How can you think further ahead, have vision like someone like John Waits? Think about how we might all collaborate with each other, and then think about, okay, if we've got something done, how can we make it better? So again, you are leaders. I'm excited to work with you all, and I look forward to the continued partnership with Cahaba Medical Care. Thank you.
Thank you, Dr. Austin. It is also my great honor to introduce truly a living legend in rural medicine, my friend and colleague, Dr. Sumter Blackman. After graduating from the University of Alabama School of Medicine in 1969, Dr. Blackman opened his private practice in Camden, Alabama, where he has served faithfully for over 50 years. He's a cornerstone of care in one of the most medically underserved counties in our state. Dr. Blackman really has done it all. Clinic visits, hospital care, emergency calls, nursing home, hospice rounds, house calls, and river calls. We won't tell that story tonight. But he goes anywhere and everywhere in the county to take care of patients, and he's served as chief of staff at the J. Paul Jones Hospital, chaired its board, stood at the front lines in the fight to keep the hospital's doors open. He's received multiple honors for his extraordinary contributions to rural medicine over the decades, including awards from the University of Alabama, and in 2024, he was formally inducted into the Alabama Healthcare Hall of Fame. And he still isn't done. He continues to practice with us and teach. He learned how to use an electronic medical record a few years ago when we merged together. And he's still teaching because he believes in the future of medicine. He believes in these residents and that rural Alabama deserves great doctors. So please join me in welcoming someone who has not only witnessed history, but shaped it with this legacy of service, humility, and unwavering heart, Dr. Sumter Blackman.
It's an honor to be here. Um, I wish my mother could hear that. She would believe. I'm looking out at all of these family practitioners. I have never in my life seen so many. To illustrate how, well, first, can you hear me in the back? Can you hear me in the back? Sometimes I wonder what it's like. Back when I was a child, I was giving a talk with the Medical Association. There were 2,000 people there. They weren't there to hear me, I don't think, because there was a hedge fund manager coming behind me that was going to tell the doctors how to invest their money. So you wonder if that's okay, fine. So the mic was not working well anyway. I said, can you hear me in the back? Yes, sir. And the guy stood up and said, we can't hear you back here. And everybody on the first 5 rows got up and moved in the back. It was embarrassing. Well, I'd like to congratulate all of you family practitioners to show you how things changed. When I graduated in '69, there were 78 students in my class, and that was all of the doctors who graduated the whole state of Alabama that year. And there was only one out of that 78 that went into general practice, as they call it then, family practice now, of course. And it's just so good to see the interest in family practice. You are the gatekeepers. And here you're all full-fledged doctors, no more going to school, no more teachers, ugly looks, books. You are full-fledged doctors. You don't have to go to school anymore. Every day you're going to be going to school. And every day you will take a test. It'll be a little bit different than the test you've been taking. But every day it's going to be a test. And you will have all kinds of exposures to all types of things. Most of them I hope will be good. I know you will. Every now and then you will get an experience that's not so good, but it happens. You will get some of those 1,000 times more than you remember the good one. But in every experience, in every patient you have, in every diagnostic challenge you have, you've got to reach for that perfection out there. You'll never get it. You will never get the perfection, but the important thing is to reach for it. I don't know of but one perfect physician. What, he lived 2,000 years ago. He didn't even have a stethoscope. But the deal is to always be reaching for it. You don't have to grab it. Some famous poet somewhere in some poem said, man and woman's reach should exceed their grasp, or what's a heaven for? You got to roll that over in your mind, but it means something. The other thing I want to tell you, and it's best told by a story or an event that happened to me. Years ago, I had a malpractice suit brought against me. We won it. but it was a heck of an experience to go through that. I had a great lawyer, his name was Tommy King. I'd never been in a courtroom. I had no idea of how proceedings went. So he was taking the part of the plaintiff lawyer, and he was asking me questions. He said, what they're going to do, they'll ask you your name, Sumter Blackman. They'll ask you what you do. I'm a family practitioner in Camden, Alabama. Where you went to school, et cetera, et cetera. I could tell that he was not impressed with my answer. I said, well, Tommy, how would you answer these questions? He said, well, I'd tell them my name is Sumter Blackman, and I'd tell them that I had the privilege of being a family practitioner in Camden, Alabama. That he had the privilege of being a family practitioner in Camden, Alabama. Oh, that word just hit me between the eyes. I think for too long I'd been on the other side of that equation. But after we won that case, I started doing a 180. And I've not made the transition all the way, but I'm getting there. And I'll tell you, things are so much better when you realize that it is a privilege that someone lets you doctor on. Now, I'll ask you to do this. Every morning, you get up, you have your coffee, get in the car and go on to work, whether it's going to an office, OR, ER, what have you. On the way, think about reaching for the best thing that can reach for perfection. Second thing you want to do is realize it's a privilege that you are a family practitioner. And last but not least, ask the good Lord to help you with every decision you have to make that day. If you do those things, you will be a very good family practitioner. Good luck to all y'all.
Turn this one on. Yeah, thanks. Before we get to the residency graduates, we have a few things. We have the fellowship graduates and the awards. Let me tell you, in family medicine, what a fellowship means is a 4th year of training. These are some folks that after their family medicine residency, they spend an extra year of training. We are a program that is a part of a pilot program where we are creating more and more fellowships, believing that medicine in the 21st century has gotten complex enough that there's additional training to be had. So we are part of an AIR program, Advancing Innovation in Residency Education, and we want to present to you tonight some of the fellows who have spent an extra year with us. And Dr. Elizabeth, I think there you are.
Good evening. My name is Dr. Elizabeth Lee, and I'm the OB Fellowship Director for Cahaba UAB Family Medicine Residency. Okay, give it a clap. Oh, I'm so excited. And this year I've had the pleasure to help train two wonderful people that I'm so very proud of, and I've been able to watch them grow from little baby interns to now colleagues. So first we have Dr. Carrie Brackett. Dr. Brackett's going to be staying with us as an FMOB faculty at Cahaba Medicare at the Centerville location, and she's going to be delivering at the medical center. And next we have Dr. Amanda Paramore, and Dr. Paramore will be joining as an FMOB at MENA Regional Health System in MENA, Arkansas. Thank you so much. I'm proud of both of you.
Good afternoon. My name is Dr. Boone Roundtree. I have the distinct privilege, to use Dr. Sumter's words, of presenting Dr. Victoria Chisholm. She is a native of Sanderson, Florida, and obtained her undergraduate degree at UCF in biomedical science before going on to get her osteopathic medical degree at Lee-Com Bradenton. She is our first graduating behavioral health fellow in a fellowship program that she actually got up and running and off the ground in her residency. As a psychiatrist coming into a family medicine practice, this warms my heart, and I am excited to announce that she will be staying with us as faculty for our rural psychiatry and family medicine residencies.
Okay, I want to introduce Dr. Taylor Hale, who stayed and did a pediatrics fellowship with us. You might ask, what is that? Well, this was something else that we invented with Taylor. She said she was very interested in the care of kids. She was one of our residents, one of our chief residents. One of the things I love about Taylor is that she is so passionate about learning and listening. She has spent the year at our United Ability Clinic getting more advanced education and caring for children with developmental disabilities and physical disabilities, both in medical care, but also helping families navigate the complexities of the medical system. She is stepping in to help a more pediatric-focused continuity clinic with our residents, and I'm glad to say that she's going to be staying on with us next year.
My name is Dr. Lacey Smith. I serve as Medical Director, Chief Operations at Cahaba, and the Senior Associate Medical Director of the Cahaba UAB Family Medicine. I get to present two awards today. The first is the In-Training Exam Award. So one of the many obstacles that we face as we go through medical education is a series of wonderful standardized tests that we have to pass before we can become board certified. So every October, family medicine residents across the state get to sit for an in-training exam. This is supposed to be a benchmark for us to help us determine how well is each resident learning the medical knowledge that they need to be a good physician. We like to recognize the resident who put in the time to study, prepare, and succeed at the in-training exam. So this year's winner is Dr. Matt Spence. I also get to present the SCN resident teacher award. So not just in medicine, but I think each of us can think about people who have taken time to invest in our life and in our education in whatever profession we have chosen to go into. That is true in medicine as well, of course. We can all think of people who took extra time to ensure that we understood some medical knowledge concept or understood a important system within the clinic or hospital that we're working in. And over time, that really contributing to the success, to our professional success. And so each year we allow the residents to vote on a peer that they feel did this, that was invested in the education of the residents and the medical students around them in a way that contributed to their success. So this year we have a resident from each campus that is being awarded this. So I'm going to call all four of you up together. Please stay up here with me and we will all take a picture together while everybody watches. The winners are from the rural campus, Dr. Chris Ingram. From the Frontier campus, Dr. Josh Murphy. From the Urban campus, Dr. Colby Earls. From the Highlands campus, Dr. Vitaly Yakubov.
Family doctors serve as champions not only for their patients and their medical care, but also for their communities in our field of specialty. In order to foster these essential abilities and interests to influence the future course of the healthcare reform, it's vital to involve family medicine trainees in advocacy activities at various scales, from the very local to regional and even national advocacy. The Association of Family Medicine Residency Directors has created a AFMRD Resident Advocacy Award. This year we're going to honor 2 residents who have exemplified advocacy for patients and our specialty in both the local and national level. So this year's 2 awards, I'm going to, again, like Dr. Smith did, I'm going to put both your names on the slide. I'm going to talk about you as you guys walk up and stand here while everybody honors you. Yeah. So Dr. Josh Murphy, his leadership and advocacy has been instrumental in building the Frontier Residency Program in Marion and Camden. He consistently advocates for his future residents, working to improve rotations, enhance their quality of life, and support the growth of the residency every day. He has represented the program at numerous residency fairs, showing his dedication to its success. Notably, he wrote a thoughtful and well-articulated letter advocating for the closure of the AmeriGas site, which was not even his track, the rural track. It was an epic letter. It was like everybody, a lot of y'all wrote a good letter, but I should forward this around. Josh, thank you for really all of our work and conversation together. And Kaylin, she has been a chief resident in the rural track. Come on up, Kaylin. She has not only helped me at a couple of different fly-ins with the American Association of Teaching Health Centers in 2024 and 2025, but she instrumentally participated in 3 different HRSA events. The first, we just kind of shoved her out there, say HRSA's here, talk to them, and then they invited her back twice, once to DC to talk with them about maternal health, and so thank you both for your advocacy efforts. The Gold Humanism in Medicine Award. This is from a community of professionals who have been selected by their peers for their compassionate career, and it reinforces and supports the importance of human connection between healthcare professionals and their patients. Humanism has been defined as maximizing human flourishing, life, health, happiness, freedom, knowledge, love. Compassionate, collaborative, scientifically excellent care depends on seeing the other person as truly human. The humanity of our patients we care for and our own humanity can be frequently overlooked in the day-to-day bustle of electronic medical records, prior authorizations, peer-to-peers. Do I need to go on through this list? Without a deep understanding and respect for each other, we all suffer. Even our own mental health is at stake, and connection to each other is at risk. James chapter 2 says, don't favor some people over others. Instead, love your neighbor as yourself. These attributes are integrity, excellence, collaboration, compassion, respect and resilience, empathy, the ability to put oneself in another person's situation, and service. Scientific evidence demonstrates that when healthcare professionals give compassionate, empathetic, humanistic care, patients are much more likely to adhere to their medical regimens, which results in better outcomes, which is what we're all here for. We have tried to hard code this into our culture. The residents know what the C4s are, and doing what's best for the patient is our first and foremost. And in Matthew chapter 25, it says, I tell you this, you did all these things to help other people. These may not have been important people, but they were my friends. When you helped them, you also helped me. So this year, from each track, this year's Gold Humanism Award in Medicine goes to Dr. Marian Lobus, Dr. Joshua Murphy, Dr. Josh Murphy, Dr. Craig Gordon, and Dr. Katie George. Graduates, track directors, you're up.
Hi, I'm Dr. Janie Bishop. I am the Frontier Track Director. I came into this role earlier this year, so I have not been with these graduates for their whole training. There are lots of other faculty in this room who have contributed to the great doctors that they have become, and I'm just really thankful for the privilege to have gotten to know them after or over these last several months. So, we're going to start with, first we have Dr. Josh Bro. I knew I was going to be the awkward one. Okay, first we have Dr. Josh Bro. From his hometown of Cummington, Louisiana, he graduated from Louisiana State University with an undergraduate degree in chemistry. Dr. Bro also has a master's in science in microbiology and in immunology. He went on to complete medical school at Tulane School of Medicine. Dr. Bro has been supported by his wife Natalie and children Josh and Jacob throughout his residency. Dr. Bro is a member of the ultrasound track. After graduation, we are thrilled to announce that Dr. Bro will be staying at Cahaba Medical Care. He'll join our Camden clinic, like Dr. Waite said earlier, where he will practice in family medicine, pediatrics, ultrasound, and medicated assisted therapy clinics. Dr. Bro, please come to the stage. Next, we have Dr. Joshua Murphy from his hometown of Stephenville, Texas. He completed his undergraduate degree at Arlington State University, where he majored in biology and minored in chemistry. Dr. Murphy also received a degree in international medicine and public health through the Institute for International Medicine. Dr. Murphy attended medical school at Texas College of Osteopathic Medicine at the University of North Texas Health Science Center. He is a designated osteopathic track resident. Dr. Murphy participated in our ultrasound track and global health track. Since joining residency, Dr. Murphy's community service and extracurricular roles included Frontier Chief for the academic year, Frontier Recruiting Chair. Dr. Murphy published A Chance to Touch is a Chance to Heal, using OMM in athletes with acute concussion symptoms in 2023. After graduation, Dr. Murphy will be joining Cahaba Family Medicine Residency and UAB Global Health Fellowship in Birmingham. There, he will practice in family medicine, pediatrics, ultrasound, and medicated assisted therapy. Dr. Murphy, please come to the stage. Next, we have Ajama and Borcha Okeke. From her hometown of Selma, Alabama, she graduated from the University of Alabama in Huntsville with an undergraduate degree in biomedical science and a master's in biomedical science from Rutgers Graduate School of Biomedical Sciences. She went on to complete medical school at Rowan School of Osteopathic Medicine. Dr. Okeke was supported throughout her residency by her dog, Lucy Species. Since joining residency, her community service and extracurricular roles included Wilcox Central High School Career Day presenter and speaker, keynote speaker at 100 Black Men of Selma Incorporated Adolescent Healthcare Advocacy Mentorship Program, keynote speaker at Marion Courthouse Annual Breast Cancer Awareness, guest medical expert and speaker for Marion Public Library Summer Reading Program, resident physician screener for school physicals for Francis Marion High School in Marion, Alabama, and health expert volunteer at Horseshoe Farms in Marion, Alabama, and Lunch and Learn medical expert speaker in Uniontown, Alabama. She has served in various leadership roles throughout the residency, including Frontier Chief for the academic year
chairperson, recruitment chairperson, clinical, learning environment review resident representative. Next, Dr. Okeke will be joining a behavioral health fellowship at the University of Alabama in Tuscaloosa, where she will practice in family medicine, inpatient, and pediatric care. Dr. Okeke, please come forward to the stage.
Hello, I guess I get to break the cycle and say thank you and say hi. I'm Dr. Cahaba, KK, and I just wanted to say this has been a long journey. Graduating from medical school in 2015, I didn't think it would take 3 attempts, and 10 years later for me to finally finish my residency training, but I am so happy today that I'm here. I want to thank my family, I want to thank my friends, I want to thank Dr. Bates and Dr. Smith for giving me this opportunity. I want to thank all the faculty, the attendings. I just wanted to thank all you all for speaking life into me, for believing in me. I especially want to thank my godfather who just passed away last Thursday, Dr. Chudi Okoye. I just wanted to say my heart is full, and I just remember a quote from my favorite author, Dr. Octavia Butler. She said, there's something that you want as deeply as you have air in your lungs, you will have it. So I will have it. I will be practicing family medicine, and I will realize my dream. Thank you so much.
Josh Murphy, were you going to say words as well? Because I completely didn't let you. I don't know where you're sitting, so if you want to come say this. Speech.
I just wanted to say thank you, Ijama, Mike, Josh Sr., for just putting up with me these past 3 years. We've been through a lot together. We collectively have kept all the Central Alabama gas stations open. And every cop and windshield repair mechanic knows us on a first-name basis. From blazing the trails on the Frontier program to the ever-changing curriculum, I could not have asked for a better group of co-residents. Thank you. Osama, Reese, Garrett, and Solomon, we had grand aspirations to hand off the Frontier to you for in a very nice, neat package, but the box got wet and the contents fell and splat on the floor, so I'm sorry. But you have a good team of support people helping you pick up those pieces, and I know that y'all will lead the Frontier well. And if any of you need a prescription of Zoloft, just let me know. Chigozie, Johnny, Robert, Daniel, I think we literally talked more over the computer screen than we actually did face-to-face. But thank you for bearing with the many challenges and for just being so gracious to us Chiefs. Batul, Samina, Ani, Paul, we are so very excited for the 4 of you to be joining us. Despite all the challenges you will be facing on the Frontier, you really have a team that truly cares about your success and are there for you. Dr. Lincoln, Dr. Lishman, Dr. Luther, Dr. Bishop, thank y'all for each one of you being program director for us during each season on the Frontier. To all of our faculty, staff, and residents from Frontier, as well as the Highlands, Urban, and Rural Track, thank y'all for y'all's mentorship and for y'all's friendship. For the Bessemer Clinic and MAs, and you have taught us when we were still terrified interns that were scared to hit the order button. The Marion and Camden clinics led by Tabitha and Hannah, Elizabeth and TK, you took us underneath your wings and grew us to the doctors we are today. Dr. Waitson Smith, thank you for not firing me and for giving us such an amazing learning opportunity. Dr. Blackman, if I could only become half as good of a doctor as you are, then I think I would be a great doctor. Thank you for your friendship, mentorship, and encouragement. Mom, Dad, Caleb, other family, thank you for your support and for all that you have done these past 23 years of medical education. Thank you.
I didn't forget Josh Brill, right? You didn't want to speak. Is that right? Y'all, I was just trying to make the night go faster. Last but definitely not least, we have Dr. Mike Wu. He is from Louisville, Kentucky. He graduated from the University of Kentucky with an undergraduate major in physics. He went on to complete medical school at Lincoln Memorial University DeBuss College of Osteopathic Medicine. He has been supported in residency by his wife, Cindy. During his residency, Dr. Wu led a variety of student and social events. Next, Dr. Wu will join a private FQHC in Levanto, Florida, where he will work in a nursing home setting. Dr. Wu, please come forward to the stage.
Well, I had an agreement with Ijama that she said something, I had to say something else. So, thanks, Ijama. Well, as I'm slowly being simmered alive in the suit over here, I gotta make this fast. So, first of all, thank you for my lovely wife, Cindy, for, well, simmering me with love and support. Thanks for her parents as well, for unwavering support for the last 3 years as well. And thanks for Cahaba for adopting me as part of your family. So thank you very much. And just reflecting a little bit, like 3 years ago, or as we at Frontier calls it, 4 coordinators ago, that was a simpler time, you know. When I first met Dr. Okeke over there in the parking lot, her name tag had Dr. Ijama Okeke on it. And I was like, well, I guess Cahaba only hires doctors. That's why only doctors as residents, and I'm very well underqualified. That gave me some scared. And for my bro, Dr. Bro, that was 2 kids, 2 cats, and a dog ago. No idea how he does it, and I just want to kind of be him when I grow up. And for my dear friend, Dr. Murphy, who is sweeping awards tonight. I just want to say he's reliable, you know. I mean, if you give him a task, he will do it. Josh Murphy is someone that you call when you're running out of your last roll of toilet paper. That's all I'm saying. And well, one of the 20 said the best. You know, this is the best 3 years of your life, the most fun 3 years that you don't want to ever repeat in your life. But for real though, like to my future Frontiers men, Frontiers woman that's coming after us. I think the 4 of us tried our best to make the track as great as can be, and we know that we left in good hands, and y'all will make us proud. Thanks, guys.
Track director for the Highlands track of the Cahaba UAB Family Medicine Residency Program. It started with a bang. We started after the match, after soap, like the 4th week of May. I think we were doing interviews. We had 1,000 applications. We narrowed it down to 100, and we definitely got the best 3. And so we're going to talk about them today. Providentially, we we had a great beginning to this residency program. I couldn't have asked for better residents. So we're going to talk first. First, we have Dr. Kitty George. Kitty is from India, but she was born in Riyadh, Saudi Arabia. She completed med school at MES Medical College in India. Dr. George is here supported by her husband George and children Chrysalin and Griselda. She has been involved in her residency program with community service with our mobile wellness clinic, the EAB clinic, working with sports physicals. She published a gem, effective opioid use on obstructive sleep apnea, and she's also worked on a quality improvement project regarding colon cancer. She has served as a Highlands Chief resident, and after graduation, Dr. George will join a private practice in Bridgeport, Connecticut, and hopefully be reunited with your husband and work as a primary care physician. So Dr. George, please come forward to the stage. Next, we have Dr. Vitaly Yakovlev. Dr. Yakovlev, home is, and I hope I pronounced this right, Cherkasy, Ukraine. He graduated from the Bogomolets National Medical University. He's supported here by his wife, Yeser, during his residency. Dr. Yakovlev, during his second year, received the UAB Patient Experience Excellence Award. He has served as a Chief Highlands resident during this academic year. He published an article, Mindfulness-Based Stress Reduction as Effect of Escitalopram on the Treatment of Anxiety Disorders. He took part in our Faculty Development Fellowship. After residency, Dr. Yakovlev will be staying with us and be working in our UAB Hoover Clinic as an assistant professor. Dr. Yakovlev, please continue. Lastly, we have Dr. Omosepe Abebu. Omosepe is from Houston, Texas. She obtained her undergraduate degree from the University of, her medical school degree at the University of Benin and her undergraduate degree from the University of West Florida. She's supported through her residency by her husband, Etanosa, and her children, Jasmine, Elsis, and Tiffany. Since joining her residency, she's been involved with community service with our Live Health Smart Wellness clinics and Birmingham City School Physicals. She has received various honors throughout her residency. She was part of the STFM Faculty for Tomorrow Residency Scholars. She received the Rocky Balboa Award issued in 2023 and a Scholarly Excellence and Exemplary Leadership Award issued by the International Medical Graduates Academy in 2024. She has been a Highlands Chief Resident for this past academic year. She's been a recruitment chairperson. She's worked with our CLARE committee. She has had multiple publications, 9 publications throughout residency, most of them dealing with lifestyle medicine. So she's our academic rock star. Next, Dr. Obeafun will be joining the Endocrine Obesity Medicine Fellowship with UAB Endocrine Department. So she'll be staying with Birmingham as well, so we're happy to keep her here. Congratulations, come on up. Please come forward.
First off, I want to thank my very good friend and brother, Dr. Philip Ojebulu, who introduced me to Cahaba Medical Care. He also invited me to the Global Mission Health conference held annually in Kentucky, where I got to meet Dr. Jonathan Peters. Thank you so much, Philip. Thank you, Dr. Waite and Dr. Smith, for the opportunity to train at your program. I've had an extensive and comprehensive training in the last 3 years. Thank you to my amazing program director, Dr. Salsa, and my faculty advisor, to all my preceptors and faculty for your mentorship in the last 3 years. I'm grateful. To all my co-residents, it's been a fun working with you all. To my amazing coordinators, Heather and Candice, I love you guys so much. Thank you for your support during my time in Cahaba. To my family, my parents, I love you so much. They came all the way from Nigeria. Thank you for your support. For your prayers, for your encouragement throughout residency. I love you, Daddy. I love you, Mommy. To my amazing daughters, Omosade, Adesuwa, Ehimema, I'm so proud to be your mom. Thank you for encouraging me, for always cheering me up and supporting me in the last 3 years. And this is just a reminder to you girls that you can be anything you want to be if you believe and work hard. To my husband, in Nigeria there's a word called Odogu. Odogu means king, a doer. Thank you so much, darling, for your support during the last 3 years. You are amazing. I love you so much. I remember when I got the acceptance email. My family lives in Houston, by the way. And then, after all the excitement and joy, the next question was the kids, the transitioning. And my husband said, and I quote, "Babe, go pursue your dreams. I got you." I love you, darling. God bless you. I want to thank God for making this day possible. A day I've dreamed of, a day I've wished for. I thank God for making it a reality. And then I want to conclude by reciting one of my favorite verses of all time. Proverbs 3, verses 5 to 6. Trust in the Lord with all your heart. Lean not on your understanding. In all your ways acknowledge him, and he will make everything beautiful in his time. Thanks and God bless.
Good evening to you all. I'll try not to be too much of a spectacle tonight. Crutches are an agent of entropy. I wanted to first thank our speakers this evening. Thank you, Dr. Asif, for recognizing the importance of leadership and challenging us, and the importance and the impact of collaboration, useful collaboration. That was a great message. And Dr. Blackman for challenging us about reaching for perfection and appreciating the privilege of our sacred position. I want to take a moment for myself and just warmly welcome friends and family of our graduates. Truly, you have invested so much in the individuals that we have seen grow over these last 3 years. Thank you for your investment in them, and we just cherish our graduates so very much. This is a truly joyous occasion. So many people have shared their own personal stories and the time that it took and the investment and the spirit of never giving up. It's just a great night of reflection. To each of the graduates, I can find some of you in the crowd. Thank you. Thank you for the honor to get to work with you, for the honor of choosing Cahaba to complete your training. I've been tremendously encouraged and blessed by each of you. Each class has a flavor of its own, a defining quality of its own, and this year's rural class is no exception. I've seen each of the individuals in this class deeply and sincerely embody true humility, a concept of true humility. I've seen this clearly displayed in their interactions with patients and even more so in the minutes and extended conversations before a patient visit and after a patient visit, trying to assure that their patients, the people that they were taking care of, received the most excellent care. I've seen this humility displayed not only in how they speak to each other when they're together in a group, but how they speak about each other when they were alone. And importantly, I've seen them each work seemingly tirelessly to skillfully accomplish thankless tasks that affect patients, their coworkers, their co-residents. And I've been challenged, speaking to the graduates, I've been challenged by each of you, by your example, and by the way that you have embodied humility. Thank you. As we begin to talk about our graduates, first we have Dr. Christopher Ingram. Oh, wrong way, sorry. There we are, finally. Dr. Christopher Ingram. He is coming from his hometown of Alpine, Utah. He graduated from the University of Utah with a major in psychology. He went on from there to complete medical school at Western University, College of Osteopathic Medicine. He's been supported in residency by his wife Stephanie and his daughter Juniper. Since joining residency, his community service and extracurricular activities have included being a resident peer advocate. He has spent significant intentional time in personalized teaching, professionalism coaching, and strategy. He has been a student liaison and received and oriented students, welcoming them to our campus. Dr. Ingram is a designated osteopathic track resident. Dr. Ingram completed the endoscopy advanced track. Next, Dr. Ingram will be joining a family medicine practice in Coos Bay, Oregon, where he will do inpatient and outpatient adult medicine, where he will care for children and do medication assistance therapy. He will practice in a critical access community hospital located there. Dr. Ingram, please come to the stage.
Real quick, just thank you. All the staff, all our advisors, it's my work. Thank you.
Next, we have Dr. Kaylin Goranson. Coming from her hometown of Belle Plaine, New Jersey, she graduated from North Carolina State University with a Bachelor's of Science in Animal Science. She went on to complete medical school at Rowan Virtua School of Osteopathic Medicine. Since joining residency, her extracurricular roles have included, as Dr. Waits mentioned, teaching health center, graduate medical advocacy in DC, HRSA site visits. She was a PEC committee member, improving our curriculum. She was a rural recruiting committee member for 2 years, and she was a rural chief resident this academic year. She too is a designated osteopathic track resident. Dr. Goranson completed the advanced OB track and the advanced ultrasound tracks. Next, we are so very thankful that Dr. Goranson will join Cahaba's OB fellowship, expanding her clinical skills in the care of pregnant women, while also seeing other adults and children and performing all manner of outpatient procedures in family medicine clinic here at Cahaba. Dr. Goranson, please come to the stage.
I had words to say. This is basically a long list that I swear I could do other than 2 minutes of people to thank, starting with my medical assistants, from Christina Davis to Allison Jones to Kesley Petty, whom I literally could not have gotten through one day of patient care without. To my nurses, Nurse Jen, Nurse Casey, Nurse Blanche, who looked out for me, taught me more than I can thank them for, and also became some of my closest friends. To Molly Hamilton, who will always be my chief, and whether she accepts the title or not, one of my greatest role models. To Carrie Brackett and Ellie Taylor, whose friendships and yapping at El Kamal and 16-minute voice memos were the definition of girlhood and my personal favorite type of therapy. To Doctors Bishop, Lishman, Lee, and Whiten, who encouraged and cheered me on and were always there for me and my tears in their office, home, cars, or farm. To Blade, for both of my nicknames, Jenner and Winnie, they both hold a profound meaning to me. To George Hipp, for his teaching and mentorship any time of day or night that I needed it, which on most weeks was on a daily basis. To Jonathan Peters, who always pointed me back to the gospel, even though I desperately wanted a worldly answer at the time. To Dr. Smith and Waits for the opportunities they've extended to me and their personal grace and investment in me and my future. To my parents, who have stuck with me on this journey and all of my mood swings, ever since I had the crazy idea to switch from cows and horses and go to med school. To my co-residents, your teamwork and camaraderie and selfless nature made work not only possible, but enjoyable. And to the patients who called me their doctor. The patients who trusted me with their care while I was still learning, who were open and honest and vulnerable and patient with me, for letting me learn. There are more names that I could add, people who have left footprints on this journey beside me who carried me at times. Thank you for being my village. Thank you for shaping the physician I am today. Congratulations to my fellow graduates.
Next, we have Dr. Miriam Lobos. Dr. Lobos comes from her home of Asut, Egypt. She completed her university studies in medical education at Asut University Medical School with a Bachelor's of Medicine and Surgery. She has been supported in residency by her husband, Peter, and her daughter, Heaven. Next, she will join the Grandview Medical Group in Hoover in an outpatient-style practice, which will also incorporate the care of children and procedural ultrasound. Dr. Lobos, please come to the stage.
I'm really trying to take in this moment. I dreamed of this more than 10 years ago when I moved from Egypt to the States and dreaming of being a physician in the States. I doubted that can ever happen, and I thought it will stay in the dream category for a long time. But I'm here today, not just celebrating my graduation, but I'm celebrating God's goodness and His perfect timing and His promises that never fail. Can't thank you enough, everybody here. Like, let's try. I'm gonna try. But first, I will thank my family. I want to thank my husband, Peter, who I can't do it without him. He was a dad and mom for everyone when I'm not around. I want to thank my brother and my sister-in-law and my mom for always believing in me and pushing me when the times that I was about to give up. So thank you so much for staying with me and believing me when I couldn't. I want to thank my attendings, Dr. Smith, Dr. Waits, Dr. Peters, Dr. Lee, Dr. Whiten, Dr. Lishman, Dr. Bishop, Dr. Bozy. I hope I don't forget anybody, but you're not just teach me medicine. You teach me way more than medicine is to care for my patients, to go above and beyond, to see you guys every day doing this was just inspiring. I'm so honored and privileged to be trained by the most amazing, genuine, kind, smart, passionate group of physicians I have ever met. Thank you so much. Last thing I want to share with you is 3 years ago in my interview, Dr. Peters prayed with me, prayed for my family, prayed for my future, prayed for my journey. And I was so inspired with how God's work in Cahaba. I don't believe Cahaba's going and working just with the manpower. God's working with us, God's blessing us, God give us way more than what we actually can do. So I want to share with you that verse that I prayed with that day. And it's from the book of Deuteronomy, chapter 28, verse 12. It says, "The Lord will open to you his good treasures, the heavens, to give the rain to your land in its season, and to bless all the work of your hand. You shall lend to many nations, but you shall not borrow." Thank you all. Blessings to all. Thank you.
Next we have Dr. Jocelyn Reagan. She comes from her hometown of Fortson, Georgia. She graduated from Columbus State University, where she had a biology major with a minor in business. She went on to complete medical school at Edward Via College of Osteopathic Medicine at Auburn. She has been supported in residency by her husband Logan and their son Evan. We all look forward to meeting Ezra in the fall. Since joining residency, her community service and extracurricular roles have included Rural Recruiting Committee for 2 years, Spiritual and Global Health Chair, Rural Chief Resident for this academic year. She too is a designated osteopathic track resident. Dr. Reagan completed the ultrasound advanced track. Next, Dr. Reagan will join Maury Regional Medical Group Primary Care in Spring Hill, Tennessee, which is an FQHC style practice, where she will see patients of all ages, incorporating the care of children, doing medication assistance therapy, and performing procedural ultrasound. Dr. Reagan, please come to the stage.
Hi. So I just want to say thank you to my family. Thank you for my co-residents. I'm going to keep this short because I'm pregnant and emotional. And so I also want to thank everyone who helped me along the way, staff, faculty. It wasn't unnoticed. And thank you again.
Next, we have Dr. Haley Warwick. She comes from her hometown of Ripley, Tennessee. She graduated from the University of Memphis with a major in biology and a minor in chemistry. She went on to complete medical school at Edward Via College of Osteopathic Medicine. She has been supported in residency by her husband, Jeremy. Since joining residency, her community service and extracurricular roles have included community medicine chair, in which role she spearheaded and participated in multiple events, including the Back to School Drive, Christmas Present Drive for children in Bibb County, hygiene item collection drives, multiple diaper drives, and the Halloween trick-or-treat event at BMC. She also was on the Rural Recruiting Committee. Dr. Warwick is a designated osteopathic track resident. Next, we are all very thankful that Dr. Warwick has chosen to stay on faculty here at Cahaba and begin practice in the Woodstock Clinic, where she will see adults and children and perform all manner of outpatient procedures in her family medicine clinic. Please come to the stage, Dr. Warwick.
I had to write my speech down, so I'll forget it when I got up here.
So it's been a long 3 years, but we have finally made it. I'm so grateful and blessed to have had my four rural classmates by my side the whole time. Residency was anything but easy, but it taught me about medicine, myself, and the role I play in this big world. I couldn't have done it alone. God and I had our ups and downs to this experience. There were times I was mad and questioned him. And there were times when I was amazed and I wept in amazement as I watched him work through us at Cahaba. I owe a special thank you to my husband, Jeremy. I don't think he had any idea what he was getting into 3 years ago, but he has been my rock for me. He has rejoiced in the good and held me through the bad. He has supported me in my passion for helping others and helped pick up the pieces when my heart is broken. I also want to thank my family who supported my dream of being a doctor since younger days. I also owe a special thank you to my mom. She's always been through the good and the bad with me. She's been one of my biggest cheerleaders and also my phone call at 4 a.m. in the morning when I've dealt with an emotionally hard ER case. I know I wouldn't be here today without her. I am thankful for the relationships I've built during my time at Cahaba, especially those with the Lee family. They have always just been a call away when I needed them. They became our family here in Alabama. They also got Jeremy and Alan back into church. I'm happy that residency and this chapter of our lives are over, but I'm even more excited to see what's in store for the future here at Cahaba.
Dr. Peters. Good evening, my name is Jeremy Kreider. I'm a family physician and proud residency papa this evening. So first for Urban, we have Johnny Angel. He's from Palm Bay, Florida, graduated from Central Florida, majored in biomedical sciences and minored in health sciences. Went to complete medical school at PCOM, Georgia. He's completed the advanced ultrasound track. After graduation, he will be joining a private practice in Fenton, Michigan. Dr. Angel, please come to the stage. Next we have Dr. Craig Bourne. He's from Canton, Georgia. He graduated from Oglethorpe University where he majored in biopsychology and minored in chemistry and sociology. Attended medical school at Lincoln Memorial University DeBusk College of Osteopathic Medicine. He's been supported in residency by his wife, Marissa. Throughout residency, he's participated in street outreach, served in residency leadership for students, community medicine, global health, and clinic leadership. He is a designated osteopathic track resident. After graduation, Dr. Bourne will be joining our Cahaba Fairfield Clinic and will also be working with the urban residency. Dr. Bourne, please come to the stage.
And honestly, all of my co-residents, the attendings, the faculty, it has been amazing and fun in like a type 2 and type 1 fun version throughout these past years. And so excited to stick around. Thank you for the opportunity to stick around. And just, yeah, continue to love people well. So thanks, guys.
Thank you, B-Hug back here. It's warm on the stage. He hasn't fallen off yet. All right, next we have Dr. Daniel Brake. He's from Montgomery, Alabama. Graduated from the University of Auburn. with an undergraduate degree in biomedical science and a master's in kinesiology. Went to complete medical school at the UAB Hearsink School of Medicine. Been supported in residency by his wife, Kenan, his children, Theo, who may be right over there, hey Theo, and Murphy. Since joining residency, his activities include serving as urban chief resident for this academic year, serving on the Hospital Medicine Service Committee. And next, Dr. Brake will be joining our very own Cahaba UAB Sports Medicine Fellowship in Birmingham, Alabama. Dr. Brake, please come to the stage. Next, we have Dr. Rachel Brown Powers. Dr. Powers is from Troy, Alabama. She graduated from Troy University with an undergraduate degree in biology. She went on to complete medical school at ACOM. She's been supported in residency by her husband Ethan and children Eli and Ty. During her residency, Dr. Powers received the Wound Care and Surgery Award. She's in the advanced OB track during her PGY2 year and served on the Pediatrics Committee. Next, Dr. Powers will be working with the UAB Family Medicine in an outpatient setting at the St. Vincent's East location. Dr. Powers. Go ahead. Looking for my cue for where I'm supposed to go next. I'm told I went out of order. Okay. So next we have Dr. Shruti Damodara. Dr. Damodara is from San Jose, California. She graduated from Dominican University of California with a major in molecular cell biology. She went on to complete medical school at Nova Southeastern University's Dr. Kiran C. Patel College of Osteopathic Medicine. Since joining residency, her activities have included enhancing social cohesion, including the Residency Lounge photo board, and publishing the article, Can Osteopathic Interventions Be Delivered Through a Telehealth Format? Dr. Damodara is a designated osteopathic track resident, and she has completed the ultrasound advanced track. Next, she will be joining a not-for-profit clinic in San Jose, California to work as an urgent care physician. Please come to the stage. Next, we have Dr. Colby Earls. Dr. Earls is from Mount Juliet, Tennessee. He graduated from the University of Tennessee in Knoxville, where he majored in community health. He went on to complete medical school at the University of Tennessee Health Science Center. Since joining residency, his activities have included serving as an urban chief this academic year and assisting in recruiting and student activities. He was a member of the global health track and the ultrasound track. Next, Dr. Earls worked at the Cahaba Fairfield office, working with urban residency and completing the UAB Emergency Medicine Global Health Ultrasound Fellowship. Dr. Earls, please come to the stage. Next, we have Dr. Michael McNabney. Dr. McNabney is from Morristown, Tennessee. He graduated from the University of Tennessee at Chattanooga with a degree in biochemistry. He went on to complete medical school at the University of Tennessee Health Science Center. He has been supported in residency by his wife, Alexandria, and children Boone, Oliver, Layla, and, as of last month, Valley. Dr. McNabney was a member of the advanced OB track. Next, he will be practicing in Cahaba's Camden Clinic and work with the Frontier Residency. Dr. McNabney, please come to the stage.
I'm thankful tonight to stand up here, to be graduating. Thankful for the Cahaba organization, that it's not just an organization, that it's not really just a residency, it's truly a family. When I joined, I came as a med student, and I could see that, and that's what we're doing here. Thank you to Dr. Wade Smith for the organization that y'all have built, the time and effort that you've put into allowing 20 of us to stand up here today to graduate as family medicine physicians. Thank you to the support staff, Katarina, for all the cold calls. You might have a couple of missed calls. You haven't called me back yet. Maybe tomorrow. Jasmine and Tyler, and all the other support staff, y'all that have made our residency experience wonderful, doing all the things that you do behind the scenes. To our MAs, Miss Yolanda, you taught me so much. You won me $20 on the roulette table by putting 20 on black. To all our other MAs who aren't here tonight, we couldn't do it without them. They teach us so much, they support us so much. We spend so much time with y'all, so thank you. To my family, my parents, my grandparents, my sister who are here, thank y'all for your support. To my wife, Alexandria, our 4 children, I couldn't have done the last 7 years running a family, running a household without your support at home. I love you, and I'm so thankful for you. Thank you to the Camden folks, to the Frontier track, for inviting me in. Dr. Bishop, I'm excited to work with you and the rest of the Frontier folks this coming year. Thank y'all.
As we're queuing up the slideshow, I just want to let all of the graduates know that we do need you to come back to the stage, so don't leave during the slideshow. We need to get one more photo with all of you after the slideshow and closing remarks.
Hello, good morning, how you doing? Waking up, shaking, yes, my taste blues, yeah. Turn the TV off, it's bad news, man. Feeling fresh like a Ziploc new man. OJ with a champagne tuna. Almost like Holy Ghost running through ya. Hell yeah, it's a new hallelujah. Popping like the top off a bottle and I ain't stopping yet. It's a brand new day. May you have auspiciousness and causes of success. May you have the confidence to always do your best. May you take no effort in your being generous, sharing what you can, nothing more, nothing less. May you know the meaning of the word happiness. May you always lead from the beating in your chest. May you be treated like an esteemed guest. May you get to rest, may you catch your breath. Oh, may the best of your todays be the worst of your tomorrows. Whoa. Oh, may the road less paved be the road that you follow. Whoa. Well, here's to the hearts that you gon' break. Here's to the lives that you gon' change. Here's to the infinite awesome ways to love you. I want you to have it. Here's to the good times we gonna have. You don't need money, you got free pass. Here's to the fact that I'd be sad without you. I want you to have it all. I want you to have it all. I want you to have it. I want you to have it all. May you be as fascinating as a slap bracelet. May you keep the chaos and the clutter off your desk. May you have unquestionable health and less stress. Having no possessions, though immeasurable wealth. May you get a gold star on your next test. May your educated guesses always be correct. And may you win prizes shining like diamonds. May you really own it each moment to the next. Or may the best of your todays be the worst of your tomorrows. Whoa. Or may the road less paved be the road that you follow. Whoa. Well, here's to the hearts that you gon' break. Here's to the lives that you gon' change. Here's to the infinite awesome ways to love you. I want you to have it. Here's to the good times we gonna have. You don't need money, you got free pass. Here's to the fact that I'd be sad without you. I want you to have it all. I want you to have it all. I want you to have it. I want you to have it all. I want you to have it all you can imagine. Oh, no matter what your path is, if you believe it, then anything can happen. Go, 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 raise your glasses. Go, 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 you can have it. I told you, here's to the hearts that you gon' break. Here's to the lives that you gon' change. Here's to the infinite awesome ways to love you. I want you to have it. Here's to the good times we gonna have. You don't need money, you got free pass. Here's to the fact that I'd be sad without you. I want you to have it all. I want you to have it all. I want you to have it. I want you to have it all. I want you to have it. Here's to the good times we gonna have. Here's to the always making me laugh. Here's to the fact that I'd be sad without you. I want you to have it all.
Congratulations, graduates. Thank you for all your hard work. For everyone here supporting them, thank you for all your support. It means the world to us. Have a great evening. And don't forget, graduates, come up to the stage for one more photo. Thank you. Have a great night.